Welcome to our compliance tip regarding appropriate use of Modifier Q6 and billing for substitute physicians or locum tenens. The information in this video is not intended as consulting or legal advice, and guideline quotes in this presentation are from Medicare guidelines. These guidelines apply to the insurance carriers following Medicare rules. Always check with your major payers to ensure your coding and billing is compliant. This video is addressing Modifier Q6 for physicians. Modifier Q6 is a HCPCS modifier used when the substitute physician is under a fee-for-time compensation arrangement, previously called locum tenens. This differs from Modifier Q5, which is reported for reciprocal billing arrangements only. We have a YouTube video for Modifier Q5, and we recommend watching this and the Q5 video as well. Today's presentation addresses reporting Q6 for physicians. It is a long-standing practice for a physician to retain a substitute physician to cover patients during an absence such as an illness, pregnancy, vacation, or continuing medical education. The regular physician may bill and receive payment for the substitute physician services as though he or she performed them. The substitute physician often has no practice of their own and may move from area to area as needed, which traditionally has been called locum tenens. A regular physician retaining the services of a locum tenens physicians is defined in this case as MDs or DOs. A regular physician may include a physician specialist such as a cardiologist, oncologist, urologist, or hospitalist. This means the regular physician is not working. The regular physician generally pays the substitute physician on a per diem or other fee-for-time compensation basis as an independent contractor or 1099, rather than an employee of the regular physician. And unless your situation falls under the Armed Forces exception, coverage must be less than 60 days. Note, an important point, the contract physician is not employed as part of another practice and is not in practice for themselves. This is where Q6 differs drastically with reciprocal billing modifier Q5. Section 116 of Medicare, Medicaid, and SCHIP Extension Act of 2007 extended exception to the 60-day limit on substitute physician billing for physicians being called to active duty in armed forces for services furnished from January 1, 2008 to June 30, 2008. Section 116 of Public Law 110-173 extended accommodation of physicians ordered to active duty in armed forces, enacted by Public Law 110-54 by striking January 1, 2008 and inserting July 1, 2008. Essentially, both legislative acts allow a physician being called to active duty to bill for services furnished by a substitute physician for longer than the 60-day limitation. A continuous period of covered visit services begins on the first day the substitute physician provides covered visit services to Medicare Part B patients of the regular physician. The period ends with the last day on which the substitute physician provides these services before the regular physician returns back to work. This period continues without interruption on days when no covered visit services are provided to patients on behalf of the regular physician or when furnished by some other substitute physician on behalf of the regular physician. A new period of covered visits can begin after the regular physician has returned to work. Do not report Q6 to bill for a contracted covering physician for a duration of 60 days or more, or when covering the physician is in the same group or part of another group practice. Never bill modifier Q6 for post-operative visits included in the global fee already paid to the regular physician. If services are provided by a substitute physician over a continuous period of longer than 60 days, regular physician must bill the first 60 days with modifier Q6. The substitute physician then must bill for the remainder of services in his or her own name. The regular physician may not bill and receive direct payment for services over the 60-day period. A new period of covered visits can only begin after the regular physician has returned back to work. CMS warns that billing modifier Q6 means the physician or group certifies that the covered visit services furnished by the substitute physician are identified in the record of the regular physician and available if requested upon audit by CMS. A physician or other person who falsely certifies any of the above requirements may be subject to possible civil and criminal penalties for fraud. Let's review the term covered visit services. With respect to physicians, the term covered visit service includes not only those services ordinarily categorized as a covered physician visit, but also any other covered items and services furnished by the substitute physician or by others as incident to the physician's services. Be compliant and learn more about appropriate modifier use. Download applicable resources from your major payers. For Medicare, this information is found in Manual 100-4, Chapter 1, Section 30.2.10. And also download the Modifier Q6 fact sheet published by CMS. Both links found on this slide can be found in the video's description below. Thank you for your time today, and I hope you enjoyed this modifier compliance tip, and that this information helps you to improve the accuracy of your claims. Consider training and certifying in various areas of compliance with the American Institute of Healthcare Compliance.